legislature.
Thanks for watching TMA's Legislative News Hotline for Friday, March 13th. I'm Brent Enier. Up this week, one step toward a Medicaid payment increase for primary care physicians, a proposal to allow chiropractors to distribute handicap parking placards, and first, details about interstate compact legislation. The House Public Health Committee heard testimony this week on House Bill 661 by TMA member Representative Dr. John Zerwas. The goal of the Interstate Medical Licensure Compact Bill is to make it easier for qualified physicians to become licensed in multiple states if they so choose. Dr. Russell Thomas, an Eagle Lake family physician, told committee members the measure would keep the practice of medicine in the state where the patient is, not where the doctor is. It could increase physician participation in telemedicine, and for doctors who want to be licensed in multiple states, this would streamline the process.
Currently, if a physician wants to license in the state of Texas from another state, they have to go through the process of filing an application, getting primary source verification, which means they have to send all of their original records, their diplomas, their grades, perhaps even as far back as high school and some of those types of things in order to get a license. The process can be time-consuming and lengthy and can slow down the possibility of a physician coming to an area where he may really be needed in our state. What the compact does is it puts these states that agree on a common set of, if you will, higher level credentials for physicians to streamline the licensure process.
So here's what the Interstate Compact is and what it is not. It is an additional way for physicians to get a license in another state. It sets standards for who is eligible to seek licensure through the Interstate Medical Licensure Compact process. It ensures a quick process because the participating states will forego primary source verification, the lengthiest and most administratively demanding, time-consuming part of the process. And it's an administrative agreement among the compact member states to quickly share applications and data for qualified physicians seeking licensure. However, the compact does not replace the current application process in any state. It does not cede any authority over the practice of medicine to any organization or to any other state. Texas physicians' licensure remains the sovereign responsibility of the Texas legislature through its laws and the Texas Medical Board as its licensing agency. It does not require maintenance of certification to practice medicine in Texas. And if it did, TMA would oppose the bill because of explicit TMA policy against MOC. It will never require board certification as a prerequisite for medical licensure, and it does not alter Texas's medical licensure requirements. So under this bill, every physician, whether licensed by individual application or licensed through this proposed compact process, would have to take and pass the medical jurisprudence test. Some more good news for many Texas physicians. The House Appropriations Committee adopted Representative For Price's recommendation to increase Medicaid payments for primary care physicians. The move would bring Medicaid primary care payments up to Medicare levels starting in September 2015. You may recall Texas had Medicaid, Medicare payment parity for primary care physicians, which was paid for with federal dollars from the Affordable Care Act, but that was just a 2-year solution, which expired in December. Should chiropractors be allowed to issue disabled parking placards? House Bill 126 by Representative Alan Fletcher would allow that. Of course, the cards are one way to identify vehicles that are able to park in designated handicap parking spaces. Dr. Sara Austin, an Austin neurologist and member of TMA's Council on Legislation, told members of a House Transportation Subcommittee that the bill is not a good idea because determining who might need such a placard requires a medical diagnosis of the patient's disability. Only physicians have the authority to make a medical diagnosis in Texas per the Texas Medical Practice Act.
According to the Transportation Code, there are certain diseases or conditions that qualify for a permanent or temporary handicap parking placard. It's severe cardiac disease, severe pulmonary disease, severe neurological disease, severe arthritic conditions. All of those things are taken care of by medical physicians and not chiropractors. And that's the reason that medical physicians should be the ones who write the permit.
We will keep you updated on these actions and others through the coming weeks. That's all for now. I'm Brent Enier with TMA. Please join us again next week for TMA's Legislative News Hotline.